Hello and welcome to Health Professional Radio. I'm your host, Neal Howard. Thank you so much for joining us again. Our guest in studio today is Dr. Jason Williams. He's a medical doctor and board-certified radiologist and actually pioneer in minimally invasive image-guided cancer therapies, especially cryoablation combined with injection immunotherapy into the cancer. Now, he obtained his medical doctorate from Louisiana State University, and he's here with us today to discuss this new minimally invasive breast cancer treatment that's essentially scar-free as we wind up Breast Cancer Awareness Month. How are you doing today, Dr. Williams?
I'm doing good, Neal. Thank you. Thank you for having me.
Thank you so much for joining us today. You're a pioneer in this minimally invasive image-guided cancer therapy. This is a new therapy. How new is it?
It's relatively new in the fact that it's going to be used more and more to treat early stage breast cancer. We first started getting into it about 13 years ago with patients who had breast cancer, but maybe also had lung and liver lesions as well, and weren't candidates for their actual breast cancer itself. And we would go and we would treat the cancer of the breast by freezing it, and then we would also target lesions in the lung and the liver as well. And so that gave us a good idea of how successful this treatment could be just for patients with breast cancer without evidence of cancer anywhere else in their body. So, we've been doing the procedure, for 13 years, but now we're actually at the point where we feel much more comfortable about treating patients who are stage 1, stage 2 disease and nothing else, either patients that normally would go to lumpectomy, or some patients would have mastectomy. And after all the years of treating these patients, and we've seen, very good results. And there's also some other centers that are doing some trials on this as well. And in those cases, they do cryoablation, and then they'll a month later they'll do a surgical resection and see how the results were. And the results were very good. I mean, several of the centers were doing 35 patients. They would get all the cancer in 34 out of 35, which was very good results. And so now, this procedure is something that is moving to where it could be used in patients more often, and I think should take the place of standard breast cancer treatment.
Now, how much is freezing of the tissue? How much is removing of the lesion? And how much is immunotherapy drugs? Is it a combination of them all at the same time, or is it different? Each case is different.
Sure. So in patients with relatively limited disease, a smaller tumor, say less than 2 centimeters in size, you can do just the freezing of that tumor, and you can eradicate it completely. Of course, the big question is, with a lot of the patients, their problem is developing cancer elsewhere in their body later. And so there's been some work now, and there's new immunotherapy drugs that are approved that help stimulate the immune system to attack the tumor. And one of the things that was shown was this great synergy between freezing the tumor and using the immunotherapy, because the immunotherapy helps the immune system recognize to attack the cancer, but freezing the tumor actually generates the pieces of tumor that the immune system is going to recognize. It also generates an inflammatory response, which stimulates the immune system. So essentially, you're creating a tumor vaccine. So that will be kind of even the next step, and that's certainly great for patients who have more advanced disease. So if we have patients that we're worried that they're at a higher risk of developing cancer elsewhere in the body, then combining the cryoablation with the immunotherapy is going to be more appropriate for those patients.
What are the percentages of patients that actually come through this without scarring?
Well, actually, I would say almost all of them have essentially no scar. I mean, because these are done through needles, and you might see just a tiny scar that's just a little nick in the skin, but basically no different than when patients are getting breast biopsies. And so cosmetically, it's far superior to the other options.
Now, you mentioned that there are other clinics that are engaged in the same type of procedures. Where is your clinic located?
So we have a clinic. Basically I work I was working in the state of Alabama, but now actually I have a clinic in Boca Raton, Florida, and then we do work in hospitals in Mexico City, Mexico.
Do you have any major universities involved, or even any of the lesser medical schools involved with you in this research?
Well, we are doing some research right now associated with Case Western Reserve University in Cleveland, Ohio, and we're doing some more work combining ablation with the immunotherapy drugs, and we've just got funding for some of that work, and we want to be able to further prove the enhanced success of doing ablation with immunotherapy. Of course, also, some of the hospitals that we work with in Mexico City, some of those are associated with universities, but in the United States, it's more the basic research would be associated with Case Western Reserve.
Now, what do you foresee for this new minimally invasive procedure in the future? I mean, is this quickly going to become the standard, or do we still have another 13 years of trials to wait?
That's a good question, because a few years back I would have said that if you were asking me today that it would already be the standard, but it's been a little slower to come along because breast surgery has such a long history, so you've really got to overcome that, and it has a fair success rate, but there's continued progression of becoming less and less invasive, and obviously for nearly 100 years mastectomy was the standard, and then in the 70s lumpectomy came along, and that's really become the standard for most patients. But now this is the next progression, cryoablation, and not only will it be the fact that you've got the enhanced cosmetic results, but we think also because of the enhanced immune response, that when the numbers are there and we have enough patients to really compare head to head with surgery, that we think this will show to be superior because of that immune response.
Now, as we wrap up this segment, I'd like to ask, what stage, I guess, early detection is a major factor. So how early must that detection take place before this is a good option?
Well, and so I think you have kind of different degrees of that. So you have patients, with the early stage disease with small tumors, without evidence of, spread, outside of the breast. And those patients, I think, are great candidates to have a cure with cryoablation alone. But when you have patients who have more advanced disease, then that's where the immunotherapy is really going to come into play. And obviously, there's a cost factor for that. So you can do cryoablation alone, at a very reasonable cost, and certainly very comparative to surgery and lumpectomy, and will ultimately be less expensive. The immunotherapy drugs, they're very successful, but they have the dubious distinction of being some of the most expensive drugs that we have. And what we've done though is we take a smaller amount of the drugs and we inject them into that ablation site, so that the action is happening right where you want it, right in the tumor microenvironment, because you really want to stimulate that immune response where the tumor is. So you don't have to flood the whole body with the drug systemically to get a great response. And those patients, that have more advanced disease, that's going to really be important that you can generate that anti-cancer vaccine by combining the immunotherapy. Now, obviously, I think in the future, as the drugs become, more available, they're more cost effective, then I could see where every patient, no matter if they have, evidence of advanced disease or not, they would get ablation, they would get immunotherapy to significantly reduce the chances of them getting cancer again, even locally or spread throughout the body in the future.
You've been listening to Health Professional Radio. I'm your host, Neal Howard. We've been in studio today talking with Dr. Jason Williams. He's a board-certified radiologist, and we've been here talking about this new minimally invasive cancer therapy known as cryoablation. And we've also been talking about cryoablation and some of the other less invasive options that are available now after years and years of trials, and still in trials today. It's been great talking with you today, Dr. Williams.
I appreciate it, Neal. Thank you. Good talking with you as well.
Thank you. Transcripts and audio of this program are available at healthprofessionalradio.com.au and also at hpr.fm. And don't forget to subscribe to our podcast on iTunes.